Hi, my name's Lisa Ackerman. I'm with TACA, co-founder and executive director, and I couldn't be more happy today to introduce this wonderful human, Dr. Walter Zahordny. He's the clinical psychologist with over 27 years experience working with children and families. He's the director of the New Jersey Autism Study and associate professor at Rutgers University in pediatrics. He is also the principal investigator of ADAM, and we're going to talk about that. So welcome, thank you.
It's a pleasure to join you.
I'm going to call you Walter from now
Please
on.
do.
Thank you. So Walter, how long have you been part of the Autism Developmental Disability Monitoring Network, ADAM for short?
Yeah, so I've been part of this network from the beginning. It started in 2000, and my colleague and I, Frank Esposito, applied to the first cycle of support from CDC to develop the network. And then we've stayed it ever since. We've been conducting autism surveillance using the ADAM network method all the time across 8 cycles and now into our 9th cycle.
And we're so grateful for your work. Thank you. So in December 2021, they announced a new national autism prevalence number. Let's talk about it.
Yeah, so the ADAM network published its 2018 findings for children who were 8 years old. This would have been the cohort born in 2010. And there was a wide range of prevalence estimates from the different ADAM network sites. They ranged from 16.5 per thousand in Missouri to 38.9 per thousand in California. And if you take an average autism prevalence estimate for the network was 23 per thousand. In New Jersey, our rate was a higher rate than that. We found a rate of 28.4 per thousand, or 1 in 35 children with autism, in comparison to the overall rate, which was 1 in 43. What's important to understand about this is that it was another time in which this comprehensive, active, multi-state system identified higher rates of autism. When we started in 2000, the first cycle of our autism case finding yielded an average of 6.7 per thousand.
Wow. And
so to go from 6.7 per thousand as an average to 23 per thousand is very impressive and probably unprecedented. Of course, we used a consistent method, a consistent autism diagnosis. We controlled for different possible sources of bias, and we did whatever was feasible and possible to get to the most reliable, complete, and accurate estimate. What was very surprising from my perspective in particular was that there was a state with even higher rates of autism than New Jersey. In that 2018 report, our colleagues in California who are doing surveillance in the San Diego region established autism prevalence of 38.9 per thousand. That's 3.9%, which is, of course, practically 4%. 4% autism overall, of course, means something even more significant when you look at the rate of prevalence among boys, because boys are 4 times as likely to be diagnosed or identified with autism. So autism prevalence was especially high in New Jersey and California. And the ADAM network, this was the first time the California site was part of the network. So we can't tell whether the rate in California had gone up or how much it had gone up. What we know is the rate was very high among 8-year-olds. And in a parallel publication of the same month in the MMWR, even among 4-year-olds, in San Diego, California, the rate of autism was slightly higher than 4%.
Wow, that
That,
is,
that means autism prevalence in that very diverse metropolitan region is 4% or higher. And given what we know about surveillance in New Jersey, we also have cities and suburban school districts in a whole county in which the prevalence of autism is 5% or higher. So these are the new thresholds or the new benchmarks of autism prevalence. From my perspective, these are the most accurate, reliable estimates that people have figured out to generate. They're based on active review and independent confirmation, not on parent report or practitioner report. These are highly believable, relevant, and reliable epidemiologic estimates. And they point us to the fact that autism has increased dramatically in the 18 years that we've been monitoring autism in concert with the CDC. And that while we can't rule out the likelihood that some increase is due to better awareness or better case finding or better diagnoses, nonetheless, autism prevalence has increased very dramatically and in a way which suggests that there are some yet to be known environmental drivers pushing the rate upward.
right.
So far, we haven't seen the plateau of autism. It must plateau at some point, but so far, no one has seen that. And given what we've seen from the California Atom Group and from the California DDS, it is very likely that the next time one of these resources reports, autism prevalence will again be higher.
Right. And that I want to dive into a couple of things. Could we use the California DDS information prior, since California just joined ATOM for the first time? Could we use the DDS data to demonstrate the
Yeah.
significant growth?
Yeah, I suppose if the California investigators established a process for tracking the relation between their estimate in 2018 and the one that's coming in 2020 with the cohorts estimates established by the DDS, they'll be able to figure out the extent to which there's parity between their rates and the overall rate throughout the state. There will be differences across the state because in New Jersey, we've found also significant differences from region to region. And it's only when you look more carefully at the school district and at the county level that you're able to find what the true range and scope of autism is. I have no doubt that autism prevalence in low population rural states is lower than what we find in New Jersey and California. That deserves a study of its own. I'm not sure what the factors are. It may be that there's some protective elements at play in life in low population rural areas, or there may be some extra risk factors associated with living in congested metropolitan regions. But whether one looks at rural areas or urban metropolitan areas, it's clear that autism prevalence is increased across the US and is yet to peak. So I hope we can continue tracking autism. I hope we can track autism in a way that gets us to the most accurate information so that we can provide, using that information so that we can provide the right needed levels of service and care through the education system and through the health systems.
Exactly. And
individuals with autism don't just have autism or autistic impairment. They often have other associated or comorbid, co-occurring conditions. ADHD, intellectual disability, anxiety disorder, mood disorders. These occur in greater frequency among individuals with autism. So these are not just pictures of autism, but of the complexity of what it will take to help individuals on the spectrum.
Yeah, we answer thousands of questions every year. Seizures, gastrointestinal immune issues as well are pretty top end. So let me back up a minute. For in December, when the report came out in 2021, the news reported they believed the US increase in autism reflected a better awareness and a widening availability of services. I'd like to get your comment on that.
Yeah, to me, that's a justification for not asking better questions. Better questions would lead us to understand what's driving higher prevalence. It's kind of a conjecture to say it must be better awareness or better diagnosis or something like that. I have not really seen convincing evidence to show that that is likely. The most likely issue at play with regard to autism prevalence is the extent to which children or individuals who had or have intellectual disability are relabeled or reclassified as having autism.
Mhm.
If you're attempting to explain higher autism prevalence on the basis of that, you're not going to arrive at a correct understanding. The CDC, Kim Van Arden Braun, people have looked at the trajectory of autism in relation to the trajectory of intellectual disability
Mhm.
over a period of 15 to 20 years, and that's not the case. I'm pretty sure that also a study by Mark Blaxill and others has
Mhm.
also shown that substitution is not the correct interpretation for rising autism prevalence. So I would love to see the evidence from people who keep saying that. I know it seems maybe too harsh to say this, but when our findings came out, the media news outlets had to make some comment right away. And they pick up the comment that's among the CDC talking points for the findings, and that's what they go with. And since they heard this comment before, better awareness, nothing to worry about, it's easy for them to keep repeating it and to acknowledge and to assert that though these are high rates, that in effect, that there's nothing to be concerned about or nothing too noteworthy about it.
Yeah, and we know that there's just more kids with autism based on your great work.
Yeah, there are more children, Black children, white, Hispanic, Asian, every group from every region. And there are more children with mild autism, more children with moderate and severe autism. Even there are more children with regressive autism than there was. So the change in autism has been across the board. It's not subtle. These are changes due to better awareness can be expected to increase estimates by maybe 10% over time. But after a while, they stop being explanatory. To me, it seems like better awareness has been used for at least 14 years to interpret the increasing rate of autism. I'm pretty sure that that's a wrong interpretation. And the resources that are required by individuals with autism are here today. And they're here today at a greater level than was the case a decade ago.
Yes.
So let's not be sanguine that there's just better awareness and that these individuals have been there and are always there. They are here. the rate or the prevalence of autism has increased significantly in 2 decades. And we don't know what the upper limit is. And we don't know what's driving autism prevalence.
Yeah, your work is so important. And now, kind of shifting gears in the future prevalences, how do you think the COVID pandemic will affect the atom prevalence?
Well, we are already well through our 2020 cycle. That is the Atom Network sites. Within 6 months, we'll be completing our case finding, and we'll be beginning to write our next report. The next report may come as early as January or February of the coming year of 2023. And so this shows that the Atom Network is producing estimates more quickly than was the case before. It used to take us 2 complete years to conduct all the review, scoring, and analytic activities required to get to a good estimate and to case descriptions. Now we're doing it faster, but we're doing it faster because starting in 2018 and in 2020, the CDC established a new process for case determination that's really based on who was already diagnosed, not on who has autism. So the question has changed. The question has changed in such a way that in some states, like New Jersey, the rate or the prevalence estimate will be maybe 20% lower than it would be under the auspices of an active case finding approach.
Wow. So you think it's underreporting based on the change in 2018?
Yeah, not underreporting for every state.
Okay.
I have to say, there are some states where the information is limited. And whether you parse it 14 ways or 10 ways, it's still going to be limited.
Got it.
But in places like New Jersey, and I would say California and other metropolitan areas where there's high quality information and good access to both school and health information, the active case finding approach finds more of the true cases than what would be the case if we're relying on already diagnosed children.
Got it. Can I go back to the one point you made, and I don't know if you have this readily available, where you've mentioned about regressive autism. Do you know what percentage of cases were indicated as regressive? Is that a question in the Atom?
So here's an interesting example. From my perspective, regressive autism is an interesting phenomenon and maybe a subtype of autism. It's been well described, and I think even though there is room for discussion, it may be a true variant of autism. It's the number of children with regressive autism is in the range of 15%.
Interesting.
As part of the Atom Network, we've monitored regressive autism all through the beginning and all through 2016. Starting with 2018, however, the network is no longer tracking regressive autism. The different method is streamlined and faster, but it lets you have less information about the individuals with autism, and it doesn't allow us to identify those individuals who have autism but haven't been diagnosed. We're a couple of weeks away from INSAR, International Meeting for Autism Research. In the middle of May, at that INSAR meeting, our group has a number of posters, a number of abstracts for presentation, and one of them involves looking at trends in autism from the beginning through 2016. And it'll be, I think, an interesting paper because it's the first time that population-based surveillance has been used to ask that question determine what the characteristics are of individuals who had regressive autism in terms of severity of impairment and other co-occurring conditions. And so, yes, prevalence of regressive autism has increased, though the absolute rate has not changed. It's never,
Interesting.
in my opinion, over the 16-year period that we've tracked it, autism has, for the most regressive autism, has never gone beyond the 15% of the total.
And it's interesting, we did a survey in 2015, just less than 1,000 families, and 60% shared they felt their child had regressed and lost skills. So
That's
again, a
interesting.
parent question, not validated by any measurements and what have you. And I always trust and believe parents, but I know it's not the same methodology. So it's
Yeah. So for children, it is, of course, regression in development would be so dramatic and so unusual that a parent will notice it and
yeah.
remember it and reference it.
Well, loss of skills, loss of words.
Right. When does that happen?
Right.
In a typical developmental scene, only better skills and more skills are accrued over time, not lost over time.
Right.
So I have no
Right.
doubt that parents are reporting this. It's just that I guess we have the advantage of looking at the complete population of individuals who have autism, not just the ones that are in a way self-referred for help, for research, or for some further study. Those people may have special characteristics that we would want to learn about, but regressive autism, and we see it happening across race and sex. It doesn't just affect boys, doesn't just affect people from one race or ethnicity. And I think we are learning something effective about it, but under the new methodology, we're going to stop learning about regressive autism.
Oh, I would like to bring that question back if I had the power. Let me go back to, when do you think, to expand on a point, when do you think COVID, the pandemic, will affect the atom prevalence?
Yeah, to some extent, it is likely that some states already have shown in their 2018 findings a COVID effect.
Okay.
I'm in my, in New Jersey, we were able to access almost all the sources we intended to be involved with. We had to do it in a different way, but we were never totally precluded from a significant school district or a health center because of COVID. But I know that at least 2 states in our network were that affected that way. And in 2020, the same may be true. If anything, 2018 and 2020 estimates should go into the books with an asterisk for 2 reasons. One, the methodology is different than what preceded it. And 2, because of COVID, there were probably some states at least where the access was not the same or not as good as they wanted. And that can only produce lower estimates, not higher estimates.
Right. And we just, the calls that we get at TACA, we know people are struggling accessing services and also getting a diagnosis. So there are delays. And locally, it went from a 9 to 10-month wait list to 24 months. So, and that's a huge disparity for a kid that needs help right now, especially in that family too. So quick question going back, is this last report that came out in December 2021, is it using DSM-5, the diagnostic criteria, exclusively for autism?
Yeah, we are only using DSM-5 in this report, and we're only going to be using DSM-5 going forward.
Okay.
In 2016, we used both definitions, and that report shows you a kind of subtle comparison between DSM-4 and DSM-5 rates.
So is DSM-5 more inclusive to see more
Mhm.
or less?
I think DSM-5 is more restrictive,
Mhm.
less likely to identify uh, mildly impaired children or mildly impaired individuals.
Because of PDD and Asperger's being removed from the criteria.
Well, because of the diagnostic criteria for DSM-5 also being somewhat narrower.
Got it.
Under the DSM-4 schema, you needed 2 or 3 signs of impairment from the social domain, 2 or 3 from the communication language domain, and a number from the restrictive or repetitive behavior area. Under the DSM-5 definition, there are more mandatory elements to capture. So just by that fact alone, the definition will be narrower.
Thank you for sharing that. A lot of people ask, when I got ready for this interview with you, which is important and we appreciate it, what about adults? What numbers do we have to compare for adults? And I know you work in pediatrics, but I was just curious what your thoughts are on that.
Yeah, that is a very important question. I have to say, I don't feel we have high quality or reliable autism prevalence estimates for adults or good descriptions of the characteristics or expression of autism in adults. Tracking adults and identifying adults with autism, I believe, will be a little bit is more difficult than doing this with children.
Mhm.
Children are almost universally part of the public education system. Children with autism
Right.
are almost always part of the public education system. And that education system requires regular evaluation and testing and professional consultations from different specialists. Once the individual leaves the education system, none of those requirements are for the most part in place. And I would say it'll be very difficult to identify adults with autism who weren't already diagnosed with autism. Nonetheless, I hope somebody does take that challenge. In
I would like
fact,
someone to take that challenge. Yeah.
we don't even, in my opinion, really know that much about the expression of autism in adolescence. The Atom Network has focused on 8-year-olds and more recently on 4-year-olds. But they've avoided the question of prevalence in adolescence. I guess a sneak preview for you and your group is the fact that at INSAR, our group will have a poster on the first large-scale prevalence investigation of adolescents with autism. We did a really high-quality replication using all the CDC Atom standard methods and procedures for a group that was 16 years old.
Okay.
This cohort was born in 1998, and we surveyed them at 2014 from all the available health and education information. I think this is a first. Of course, a first in such a big district, such a big area like our surveillance region encompasses over 30,000 individuals. And we'll also have the advantage of using information from this group because they were already surveyed as 8-year-olds. The 1998 birth cohort was surveyed as part of the 2006 study year as 8-year-olds. And now in this study, we'll be in a position to compare children, 8-year-olds with autism to adolescents from the same cohort with autism. So hopefully check us out at INSAR. And in the meantime, our group is getting ready a paper for publication on that topic. So hopefully in the next couple of months, you'll be able to see something about autism expression and prevalence from adolescents.
I can't wait to see the paper and want to share
I will. I'd be happy to share that when you
it.
can.
Sorry, I'm still getting over this cold. One quick question. Asperger's, what percentage, even for DSM-4 and 5, are different? What percentage do you think of individuals in the ADAM have been Asperger's?
Yes. So this question is getting a little bit harder to answer, even harder than it was before. I'm not going to offer an answer with a lot of data, but I will give you an idea that when we have looked at the extent to which individuals with autism have IQ below 70 or IQ in the borderline impaired range, that's between 70 and 85, or in the average or higher range, which is consistent with IQ above 85, we don't find any real change in the proportion of individuals who have autism according to our criteria and have IQ in the higher than average range. It seems to be about 3%, 3 to 5% of all the individuals with autism are like that. That is autistic with a characteristic pattern of autism impairment, but with higher than average IQ. It's a small group of the autism population, and it hasn't increased. We looked at this. I know I mentioned this to you before, though I have failed to deliver the paper in that regard, but it was about 3% to 5% that is Asperger-like at the beginning, that is in the 2000 cycle in that era, and it's still at the same range in 2016, which was the last time we had comprehensive data.
Well, it's just important to keep asking that question because the news will report that it's just acceptance. That's the strategy. And that works great, I think, for 3 to 5% of the individuals that are in the ADAM survey. But what do we do about the rest?
Right.
They deserve help, support, not just for the individual, but for the family. So
Right,
thank you
right.
for humoring me to pepper that one in. So Walter, what do you think the cause of the increase is?
Yeah, I wish I could tell you, Lisa. I have to dodge that question as I've been dodging it for at least a decade.
Right.
I am certain that there is some combination of environmental risk factors and triggers.
Yeah.
I don't know exactly the weight or the extent to which any of those individual factors drives the rate higher. So I have to say we're still looking. I'm not convinced that anyone has really detected what the missing factors are, but there are clearly some things that are related to modern metropolitan life, which increase the likelihood or the risk of autism. Not only our research, but research from others in the United States points to things related to prematurity, low birth weight, perinatal complications, including straightforward things like C-section delivery, mother's age, father's age. These are related positively to greater autism risk. Also, multiplicity, that is multiple gestation, twins or triplets. Even if you control for other factors related, that seems to also play a role in higher risk of autism. Exposure prenatally to valproic acid, which is a drug that some people take for seizures.
Right.
Exposure to antidepressants may be maternal prenatal exposure to antidepressants or maternal depression may be a factor. And even maternal use of marijuana is positively associated with higher risk of autism. There's a good paper about this from Canada. Now, I'm not saying that that's the answer. It's not
Right.
people smoking pot or premature babies, but probably if you have more than 2 or 3 factors, that raises your risk profile significantly and does play a role. But I still feel like we still have to do more research to really detect what are the true drivers of autism prevalence, and if possible, to identify those things that are avoidable risk factors. There
Right.
may be things that can be avoided, which can help reduce the likelihood or risk of autism.
And it's interesting, you mentioned all of those different possible causations. It's like for a lot of families, including mine, I can say no to everything that you mentioned, and
Right.
yet we still have a high prevalence.
Right.
So definitely more research and
Yeah.
being
So,
brave is needed.
we don't know what's driving it, but we also know that something is driving it because it
Yeah.
hasn't plateaued. There's still increases here and increases coming. So there's still something for us to study and to detect, I think.
Yeah, and at least we know that there is a lot of treatments that are becoming available, and some of those things could lead to prevention, or at least just a healthy baby model, which I would love to see. Yeah, and that topic we could probably go on for a couple of days and discuss even more with charts and graphics and hypotheses. So I do want to ask another question. What do you envision and what are you seeing in the next prevalence report? You said January, February 2023. What is there anything you can share on what you're seeing in the data?
Yes, I don't know the data yet from New Jersey, and I even know less about the data from other states. So what I'm saying is only based on my understanding of the distribution of diagnosed cases and who's not diagnosed,
Mhm.
and on the observation that prevalence estimates have not peaked yet. So I guess I would predict, if I'm allowed to use that term, that the next ADAM report, the 2020 report, will show, again, higher rates of autism for the network, 3% or 30 per thousand, more or less, because we're quite close to that now. And for some states or for some sites, rates in the range of 4 to 5%. I have no
That's just
doubt
staggering.
given what we see in New Jersey, I have no doubt that autism, the real next threshold is the 5% level. We have already significant cities and towns in New Jersey, rich towns and poor towns, with rates of 5%, 7%, and sometimes higher. And there's no reason to think New Jersey's got any special risk factor or some sort of dangerous environmental situation. It's just that we're in a position, given our services and educational networks, of picking up most of the true cases of autism according to our process. So when our 2006 report came out, that seems like a long time ago. I thought I was going on a limb by saying that 2% autism prevalence looks like to be the new normal. But it's not, it's the old normal is 2%.
Right.
That's what the CDC is telling us, 2 to 3% is the new normal. So in reality, the future can only be, I guess, characterized with rates as high as 5% and greater.
Well, and we know that boys are hit 4 times as hard, percentage wise. What's that for boys?
Yeah, so we already have in New Jersey, we have significant towns and cities where the boys are at the 8% level. And
Right.
if you look at I don't have the California boys rate in front of me, but I'm pretty sure it's close to 10%.
Wow.
So it's crazy to say that, but the crazy statement is borne out by evidence and data. And if you don't want to face the truth, that's okay, but it doesn't change the fact that these rates are very high and going higher.
And then, I mean, if a woman watching this right now, pregnant, with a boy, you have a 10% chance of having a kid with autism. Is that a good, jump to, conclusion?
Yeah, now I wouldn't myself, or I wouldn't counsel a friend to make a decision based on the risk of autism or some other issue or problem. Life has to go forward, will go on.
Right.
But in another way, I guess I ask myself a similar question, which is, can we have a robust society if one out of 10 boys are impaired, or
Yeah.
uh, one out of um, or a smaller number, but nonetheless a significant number of girls is
Right.
impaired by autism?
Right.
It doesn't seem like this is the basis for like thinking that we're gonna make tremendous strides in our achievements or our individual levels of success if a large part of our society is struggling against complicated issues that require educational resources, health resources, special planning, different kinds of support. I'm
Um,
not an economist, but I shudder to think what the economic costs or burdens are of not only the care and treatment required, but the lost opportunities
right.
and
And the value of humans and what we
lost
could,
value of our human beings to this.
well, especially when impairment is a big part of it, when only 3 to 5% steadily are showing us that they're going to navigate and maybe, pardon me for saying, be quirky or not neurotypical, and however you want to describe that. And the largest group is requiring significant support. So that's the main thing I want to impress upon, and I
Right.
appreciate you sharing that. Is there,
I entered this question or this area of research because of my interest, but I always was interested in individuals who are disabled, not individuals who are different. Difference is great. Everybody's different, everybody's
right?
unique, everybody has a role to play. Everybody should be treated with respect and offered the best path forward.
Yes.
But I'm studying a developmental disorder, which was once very rare, but now is unfortunately very common. And it has a great bearing on the families affected and on the society and our society in general. Quirky individuals in their own way are going to contribute to our society. I
Mhm.
don't have any doubt about that. But a disabled person will contribute in their way, but also in a way not provide to the social group everything that might be forthcoming from a kid who had typical development.
It's so profound and so important. Thank you for sharing that insight. Is there anything else you want to share before we conclude? I really appreciate it. I could ask 20 more questions.
Yeah, I don't know. Keep getting information out. There is good quality information.
Mhm.
Keep being skeptical. Keep greeting things with a sense of concern and skepticism. But I guess I think we should also be in a position to acknowledge that autism is a real social and public health phenomenon that requires a lot of attention and more understanding. In a way, I don't expect people to believe us. That is that the prevalence is increased so significantly until we discover what the precipitating risk factors are. Once that happens, and it will happen, hopefully
Mhm.
sooner rather than later, will be
Please.
a better perspective than to figure out who's in what group or type and how to help each person according to his needs and his means. But we can't pretend this isn't an issue when it is a real issue.
Well, I can't thank you enough for your work and always being so dedicated. You are very thoughtful, considerate, thorough, and just a great resource as a human to our community. We really, really appreciate what you do. And I feel you should be recognized more for your work. So I just want to acknowledge you and thank you. And
Thank you.
stay well. Keep doing your work. And we'll
Thank
see you in January, February. We can make another date to talk about the next report, and we'll continue to talk and share this information. So thank you.
It was my pleasure. Thank you so much
Thank
for
you.
giving me the opportunity.
Thank you.